All right, so this morning we've got a great panel that is going to talk about data. So some of our panelists include, we have Meredith Levine from the Gwynn Center, and we have Jamie Ross from PAC Coalition. And then we've got Tara Rains from CAA and Kelly Bumgarner from CAA. So thank you all for joining us to have this great discussion about data. So we're going to kick it off just going around and just opening up a little bit about what each of the panelists, what their role is, a little bit about their organization, and then talk a little bit about why they think data is so important. So Meredith, do you want to kick us off?
I'd be happy to. Good morning, everyone, and thank you, Amanda, for inviting me to participate on this panel. I am the Director of Economic Policy for the Gwynn Center. If you're not familiar with us, we are a nonprofit, nonpartisan research center. We're based in Las Vegas, but we're soon to be affiliated with UNR, and so we are a statewide organization. We lead with data. So for us to come in and talk about data, I mean, we're talking about the thing that we do every day and that we truly believe in, because in our view, there's really no way to think about policy without thinking about how data informs it. And then how do you get to those interventions without quality data? And so I'm actually going to start with an example from a report that we released this week, which I think is relevant in that we know that there was a huge stimulus package passed and enacted, and that's great news, but Nevada has not typically done well with federal money. And what our report shows is that in fiscal 2020, Nevada ranked 45th on federal grants received in dollar amount per capita. And so why do I make that point? Is the ranking intrinsically interesting? Perhaps not, but it does tell us that Nevada underperforms. But here's what we don't know. We don't know what it means or why we're underperforming, because the one thing we don't know is how many grants do we apply for each year? Are we just applying and not getting them? Are we not applying at all? And so there's been an ask from the grant office and from the Nevada Advisory Council on Federal Assistance for several years to build out a grant management system. And there's, of course, a cost associated with that. But when you think about what the implications are if you put that investment in, well, that means, let's say we do find out that folks are applying for grants and not getting them, then we need to invest in grant writers and capacity building on that front. If we find out that people don't know that they can apply or should apply for federal grants, then there's socialization and outreach. And so our understanding of where resources need to go and how we bring additional resources into the state is very much governed by how we think through the data and the money that we put toward the data. So again, a couple of other examples from our work. I've done some research into uninsurance in Nevada's population. So a couple of stats there. Our research revealed that if you look at the uninsured population, more than half are Latino. And if you look at Latinos, about 1/5 are uninsured. So what is that telling us? Well, it's telling us that we clearly need to work with the Hispanic Latino population in order to think about how to get higher rates of insurance, but there could be various reasons for that. And again, that's where data becomes really, really important, because you want to think about what does it mean if somebody who is Latino is not insured? So that could mean several things. That could mean it's a higher youth population. All right, well, then there's a question about tailoring for youth. It could mean that somebody in a person's family does not have documentation from the United States. Well, there could be a lot of fear around government, and that's where a community health worker might come in and say, wait, let me tell you how this can work and how we can get you onto either the exchange or Medicaid or whatever other program. But if we don't have all that information, if we don't know the roots of uninsurance for Latinos, we're just saying, well, we've got a problem. And so data can help us get to those points. I look around the state, and again, just thinking about the terrific work that the Department of Health and Human Services has done in coordination with the governor's office in terms of having that health dashboard for COVID. And I look at that dashboard, and what comes to mind is that's public facing. And of course, internally, even if it weren't public facing, they would have a very good sense of COVID cases, incidence, prevalence, mortality, vaccination right now. But the public facing view where we could see those inequities was really a call to action from the governor to actually say, are we putting the resources in the right place to get the right folks vaccinated? And that allowed him to come forth with a diversity, equity, and inclusion statement that would really direct those resources into underserved communities. So when we think about both internally how that informs decision making, and then publicly how that can be, again, a call to action, it becomes really important. And the reason I say all this is because sometimes, particularly when there are budget constraints, it is so hard to think about, let's put the money here when we could actually be putting it toward people. But the problem is this: if you had a car, and I'm going to use a car as an example, if you had a car and you said, I don't need to get that oil change, I can, kick that down the road. Well, that oil change might cost you $60, and that's not great. But if you don't do the oil change, you might be looking at all kinds of car problems down the road that are thousands of dollars that hit you all at once. And that's how I kind of think about data investment, which is that, yeah, you're going to have to put in a little money up front, but if it gets you the resources to the right people, not only are you not wasting government funds, but you're actually doing the kind of interventions that are effective and most helpful. And I think that that's where I will conclude and turn it over to the next panelist. Thank you again.
Thank you so much, Meredith. Jamie, would you like to go next?
Sure, thank you so much. So I'm the executive director of the PACT Coalition, and we focus mainly on substance misuse, but from a community perspective. How are we all working together on this topic? Who else cares about this, which is my very favorite question to ask. And we use a lot of the data that the Gwynn Center put out, and oh my gosh, it is absolutely amazing. But I am not that high-level data guru at all. I am the community, and so my very favorite questions when it comes to data is, the first question we always ask is, what is the problem? So what is the problem, regardless of what we're talking about? For us, it's substance misuse, and so we can say, we are seeing more youth accessing fentanyl would be our problem. And then it's, but why? But why is this a problem? And then the question that I am most passionate about is the third question we always ask, and that's, but why here? What are our local conditions? What is specific to our community? Because when we're talking about these big global questions, we know that they are a problem everywhere, but what are the local conditions? What do we care about? Why is it that our youth are doing whatever it is that they're doing or not doing whatever it is that they're doing? And how do we use that data? Because once we can answer that question, then we can tailor our programs, our projects, our funding to actually address our root causes, as opposed to, let's just keep doing the same things that we've been doing. And so for us, the Youth Risk Behavior Survey, or the YRBS, is the most important data source that we have, because not only is it the only data source that we have that compares how our state is to every other, well, almost every other state in the union, because it's a CDC project, but it really gets at what is happening locally, both with our middle schoolers and our high schoolers, because we do oversample, and so we've got such rich data in the YRBS. So for us, that is such important data. And the thing that we always love about it is it really does get down to that community level. And in Clark County, obviously, with 300,000+ students in our school district, it's a very large population, but we can even get that granular with our much smaller populations, Lyon and Story counties, and they're really able to see what is happening in their schools on that community level. And I think that that is just so important. And for us, that is why we are doing what we're doing, because no one who's on this call, no one who's at the legislature, like, we're all trying to save the world. It's just, we're looking at different parts of the problem. And so that to me is why we're here. So did I answer your question, Amanda?
Yes, you did. Thank you so much. Kelly, would you like to go next?
Sure. If it wasn't raining, I would actually go outside right now. I want to check the oil change sticker on my car. After you said that, Meredith, I realized it's been a long time. I am Kelly Bumgarner, and I am the Director of Health Policy at the Children's Advocacy Alliance, which I believe most people that might watch this would be somewhat familiar with, but we are also a nonprofit, nonpartisan organization with a focus on advocacy related to children's issues throughout the state of Nevada. And I think my answer would probably be, the reason I think data is impactful, or the most important example that I can think of personally, would be what happens when we don't have access to data. And in 2021, the good news is that's fairly rare. You're going to find a researcher at a scholarly institution or an advocacy organization or a think tank who touches on just about every topic you can think of these days with the internet. But when you're able to find an example of an area where that data is lacking, it's really significant, and it shows you how big and important that is. Meredith and I have actually been kind of working through a project where we're trying to collect data related to people in our prison systems and their health care, talking about pregnant persons in the prison system, or just anyone. The data is very, very hard to access. We have a lack of data, therefore we have a lack of ability as researchers and as scholars to do anything. Another great example, I think, would be people in the Asian and Pacific Islander communities. When you look at research, those individuals are always captured under this single data point, Asian Pacific Islander. But if you talk to people, for example, at ACDC here in Las Vegas, an organization that serves members of those communities, they've told us repeatedly how frustrating that is, because there are very large cultural differences, linguistic differences between individuals of Chinese descent and Hawaiian descent. People from Japan are going to have different things that affect them and things that matter to them or impact them in a cultural sense than individuals from, let's say, Taiwan. So that's another example to me of where there's a big data gap, because we've lumped people together in this scholarly sense and under one term, and then we don't have the data to be able to talk about specific problems for specific people. It becomes a checkbox versus individual people, and that's problematic. So to me, data is invaluable, because when it's missing, it's like so many things in lives. You don't really care about it or think about it too much until you don't have it. And then once you don't have it, you realize this is a big deal. This is a big problem.
Great. Thank you so much, Kelly. And then our final panelist, Tara.
Hello, good morning. I am Tara Rains, and I am the Kids Count Initiatives Director at Children's Advocacy Alliance. And I just want to echo everything that has been said in regards to why we need data in Nevada, why it's so important to make database decisions. In my role at CAA, I use the data that's provided by the Annie E. Casey Foundation, as well as data from the Census Bureau and other agencies to help us develop recommendations and resources in regards to Nevada's most vulnerable youth and most vulnerable children. And again, without using data to make these decisions, we're making uninformed decisions, right? And I think Meredith really brought up an excellent point, is that not only do we need to be using data from other places, but we need to be tracking our own data a little bit more strongly, so that we can see what's working and what's not working, and how can we improve systems here in the state, specifically around supporting children. And so I'm happy to be here this morning to talk a little bit more about how we can use existing data and what data we have that that's easily leveraged to support our decision making and progress monitoring. Thank you.
So I'll start off by asking everybody, what do you think are some of the biggest data gaps that we have that would be beneficial to better serve our children and families? Really hope that coffee's kicking in, right? It's a hard one.
It is. You started off strong, so I'm gonna attempt to answer it and hope that my colleagues here will strengthen my answer. I think, you know, honestly, right now our post or during COVID data is a huge gap. We also know that there's lots of education related data that wasn't collected from 2016 to present. So just kind of closing some of those gaps and supporting initiatives on the national level. So I think there are lots of needs in regards to data. Other folks want to jump in?
I think to piggyback off of that, it's a lack of public education about how data works, right? Because that's not, frankly, it's not that interesting. And no one is going to pay for a PSA to explain via the television, did you know that data lags? Because that's how it works. So there's this understandable and reasonable public frustration of, well, give us the COVID stuff now, and don't give us the estimates, and don't give us the guesses. Tell us what's really happening, and don't be secretive, because if you're being secretive and not sharing that data, it's a conspiracy. It's a governmental conspiracy or a scientific conspiracy. I think it's just sort of this lack of understanding that you can't just say what you think, and you can't just say what the initial numbers are. There's a process for this, and there's a vetting of the information to make sure that it's accurate. And I don't really know how you inform the general public of that in a way that doesn't make them glaze over and want to fall asleep, because it's just really not that fascinating, but it's the truth. So I think Tara's absolutely right. It's, where's the COVID data? Well, we know that it's somewhere in limbo, but how do we explain to people that it's somewhere in limbo, and that doesn't mean that it's not real, or that it's not coming, or that it's not important?
Those are really great points. And just to piggyback off of that one thing, it's with some of the data, it's also about trust, right? And if we're trusting the data because there's, you know, I hear all the time from, you know, friends and family, well, the COVID's not real. They're just counting every death as a COVID death. So I don't believe it's a problem because, you know, we're over, which unfortunately does happen sometimes when you put money attached to deaths, you know, where people are human and people make errors, but that error, those errors and those mistakes also create mistrust in the community. And so we have to build up not only the availability of data, but to make sure that the data that we're sharing, that people can trust it and will then follow will make behavior changes and attribute other things to that data as well. Meredith, did you have, go ahead.
Yeah, I would certainly lift up of what Tara said, and to also reinforce Kelly and Amanda, your points as well, which is, you know, I had some planes flying overhead, which is why I couldn't weigh in, but that COVID point really, it did trigger for me one of the challenges, because there we did have this huge inflection point. And so we can talk about the before, and it's interesting. And I think we're going to always need to talk about that, because there are ways we don't want to go back to normal, but there are ways we do want to go back to normal. And when you think about, though, that moment in time and the impact of COVID, we just don't know. And so again, going back to my uninsurance question, I have an estimate of who's uninsured from 2020, but I don't know who's uninsured from 2020. And that's really hard, because if you want to talk about where, again, we need to put those money and resources to get people insured, it's not really, we don't have the numbers. And so, you know, and then to Kelly's point about the lag, Amanda could probably speak to this as well. We're working on a project. There is a lag in the system, and there is reason for that. One has to do with the infrastructure of technology. We have legacy systems in our government that really need to be updated, and the agencies have made the ask and said, give us money for this technology infrastructure. And then the answer is, well, yeah, but there's this other thing. And so, you know, we really can't. And so then we are in a position where our infrastructure isn't keeping up and the data isn't maybe coming in the pattern that we would expect, because it's a crisis and different things shake out differently in a crisis than they would in a normal time. And so there are various reasons for lag, but it's absolutely true that you can't really say, well, there's this lag, and then people aren't going to come back with, well, then COVID's a hoax. And so there is a real crucial distinction there, but understanding that I think is important. And then I would add one more point, which is, to me, the barrier that I run into all the time, which is, and this is just going to be true in every government, but there is a lack of sort of standardization and uniform reporting requirements across agencies. And so when you do put in those requests for data, a lot of times you have to be kind of almost inside the system before you can know what you're asking for. And so then you get, you know, you spend a lot of time and you put a lot of folks out, and it ultimately you didn't ask the right question in the right way, and they've queried the system and they've invested so much time, and then you get the data back and it's like, oh no, okay, I have to come back to you. And so it's kind of a, you know, I don't know that there's what the way is, but there probably is a way that that could be improved upon so that the data could be shared more quickly and efficiently when that lag is reduced, or to the extent possible.
And I would piggyback off of what Meredith said. I think all of us on this call, we have access to so much more data than the general public does, just because everybody's writing those 30-page reports and then emailing them out to their entire listservs, and then they live on our computers, which is great. And we have all of this data that we can then use, but the general public, unless they know exactly what 17 governmental entities have just done yet another 30-page report and where that lives on these incredibly difficult to find servers, how is this data being disseminated to the general population? And then who's aggregating all of these reports from all of these different entities and really being able to take that and understand what that means in the larger context of our community. I know there has been work in Southern Nevada Health District has been amazing of like, please give us all of your reports and we will try and aggregate them all. But there are no perfect systems, but that's something that I would say is, how do we get the data that we do have to more people? Because I think that I get phone calls all of the time saying there is no data. I'm like, well, that's not there is some data. It's not going to be perfect, and it's probably not going to be exactly what you want, but there is a lot more data than I think we realize. But how do we get that out into the community without our cell phones ringing at 9 o'clock at night because someone's writing a grant and they desperately need this data source? And so we're scrambling to figure out who sent us that email late at night. And obviously continuing to do that because we work within the systems that we have, but I feel like that's an easy problem to solve, but I have yet to be able to figure out how to solve that. So maybe that's something that the group of us might have a better idea on.
I just want to pop in and say, Jamie, you're 100% right. And maybe we start talking about like a Nevada Children's Data Consortium, where we're actually in contact with each other more regularly around what we're finding and what we're doing. I know at CAA, we try to compile, and we do the report card and we do the data book, and we're working right now to do a children's mental health data book that should be coming out in early summer. But that's not enough, right? And that's only a small snippet of what's out there, like you said. So I thank you for opening this up to a bigger conversation.
Yeah, and that's great that you bring that up, because we actually used to have a children's data center. That was a website that our center was actually funded to put together, and then it wasn't sustained. And I think that's another thing that, you know, we have to think about in the community as we put dollars into initiatives, sometimes millions of dollars, not in our data center case, but sometimes, you know, we put large investments, but if we don't keep investing in the long haul, then what happens is we end up reinventing things that already existed and doing the same process all over again, because, you know, it's a new group of people, and they're all great ideas. And a lot of the initiatives have been done before, but they haven't been sustained. So, and I think we find that a lot in our community, and I'm sure it happens in other states too. But I know here, you know, we hear that, oh, well, we tried that, and they're all great initiatives. And so really working to say, okay, how do we really get true sustainability, so that way we can have some of the more longer term data and efforts to be able to show that programming and to inform programming interventions for our communities. So I would love to get that project up and running. So yes, I think we should keep moving with that after after this call. So we talked about some, I guess, larger data gaps. And does anyone want to talk about any potential legislation that might be to keep an eye out on this session that might have to do with data or improve our data?
So for those of you who aren't aware, Senate Bill 69, it's mostly substance misuse prevention and recovery, but there is something that we care a whole lot about, and I hope you guys will as well. It actually changes the Youth Risk Behavior Survey, or YRBS, statewide from active consent to passive consent. So that will change our YRBS data from parents having to opt in to parents opting out. It will also give all parents and schools the information beforehand, because the YRBS is, of course, done, analyzed by UNR. And so they said that they would put that on their website so that we could see the questions beforehand. And so I think that's really important for all of us, since I know all of us use the YRBS data so much and for so many different things. So I think that might be something that other people will care about besides us.
And what would happen if we didn't have the YRBS data for our state?
So that's a good question. So again, it is the only set of data that is mostly uniform across, I think, all but 2 states actually do the YRBS. And so it's their CDC, it's a requirement of CDC, and we significantly oversample and we add additional questions so that we can get more robust data and information out of our YRBS. But if we don't have that, then that's where a lot of those, for federal grants, we have those required questions for, you know, how many youth are doing X, Y, and Z thing for whatever the federal grant is. And that is where most of those questions are answered. So if we do not have those questions, then I think we go from 45th in federal grants acquired per capita to even lower, because if we don't, that is not something that you can get around when you're applying for federal grants. If you don't have those GRPRA questions in an answerable format, then you can't even apply for that funding. So I think that it decreases the amount of funding that we have, and it's nice to be able to compare that data statewide as well as with other states nationwide.
Perfect, thank you. Did anybody else have any other ones or any legislation?
I'll shout out on SB2. SB2 is a bill that luckily is being amended, and I think everything's going to work out beautifully because the school districts have done a really great job at collaborating and wanting to make it something agreeable for everyone. But as originally written, SB2 did a lot of things to try to assist our school districts financially. And one of those things was removing a mandate that currently requires height and weight to be collected from students in the 4th, 7th, and 10th grades. The purpose of which being taking the height and weight of those children, putting it together to quantify their BMI, and then using that to talk about childhood obesity rates. It's time consuming. It's something that needs to be done by someone who has at least a little bit of education on the process. So there's a training that's involved, and the school districts decided that this was something that probably didn't need to be done for a variety of reasons, some of which were valid. Luckily, the amendment that has been put forward and that really makes the data a bit more robust is, instead of this being collected from a random sample of 4th, 7th, and 10th graders, the data could be collected from all 4th and 7th graders in the Clark County and Washoe County school districts, which is great news because a random sample, as we all know, is random. So sometimes it's randomly great and sometimes it's randomly poor and sometimes it makes no sense at all. So a larger data set where you're encompassing all of those 4th and 7th graders will allow better numbers that then get sent to the health district, and they're able to use that for the acquisition of grants, for publications, to track over time what's happening with obesity rates in our kids in the school districts. So SB2 right now with the amendment is something that we definitely support because it will really overall increase the strength of our data and ensure for the foreseeable future that we continue to collect that data, because there really is nowhere else that data is captured. Pediatricians take height and weight, but there is no reporting or database that they put that information into. So this is something that creates a pretty invaluable set that we wouldn't have access to otherwise.
Great. And then for both of these, so both of these have to do with collecting data in schools from youth. What are some of the things we can tell? Some people might be concerned about that, right? Having access to this data and having youth that, you know, getting this data from schools. So what would we say to people who might be, you know, have some concerns about that data?
That's a great question, and I don't want to be a hog here, but that was something that definitely came up in discussions about SB2. This is personal information. The children's parents aren't at school with them. How does this impact the children, having this data collected from the kids? And I would say that if it's something that is of concern to a legislator or to a parent, the first thing I would recommend doing is taking a moment to really find out what the bill is and then read the language, because those are concerns that legislators on both sides of the aisle, people on both sides of the issue share, and usually have been thought about and incorporated into any kind of legislation that comes forward. So the SB2 that I mentioned, for example, one of the concerns that was brought up was, well, what about the mental health and the emotional impact it may have on children to have their height and weight taken in front of their peers or in the absence of their parents? And this is data that is being collected privately. So the student meets with the school nurse one-on-one. The peers are not in the room. They're not privy to this information. And the children themselves are even blinded from the data, meaning that when they step on the scale, they don't see and aren't told what the scale says. So it's just like when you go to your pediatrician or we go to our physicians, except in this case, the children aren't told how much they weigh or how tall they are. So I think I would say that the first thing to do is a little bit of homework if it's something that concerns you as to, well, how is this done? How is this information taken from children? And then what resources are available if they do have concerns or if there is something about the process that is upsetting, because there are safeguards in place for those kinds of things. If after you have that information, you're still uncomfortable, then you have a leg to stand on and you can talk about why it's still problematic. But I think it's like any issue that we as individuals get worked up about. A lot of the time, it's just that we might not have all of the information before we're ready to get worked up and have a strong argument.
I think also, thank you, Kelly. I think, oh, go ahead, Meredith. Were you going to add?
I was just going to say, I don't know if, I'm not familiar with SB2. I don't know if there's a public facing aspect of it or if it's available upon request or that kind of thing. But I'm wondering if there's not some way to put some sort of guardrail into the bill, or at least through the outreach process, in terms of anonymizing the data, where parents and other concerned stakeholders might be able to have that assurance of saying, well, we're not going to name names, and it's not going to, everybody will be de-identified. I mean, if it's, a white child in 4th grade who is identified as male with this height and weight, I mean, that would be very hard to discern who that child would be. So I'm just wondering if there's, because that's typical, but I think people don't know that that's how it's done. So just to throw that in. Apologies, Tara.
That's a great point. And oh, I'm sorry, Tara. I was just going to say it is declassified data. So yeah, I think that's a great point too, is people think that a child or a minor is going to answer a survey and all of this information is going to be out there. But in this example, and in most of these cases, those kinds of information, names, date of birth, not that most children know their social security number, but if they did, they're not being asked any of that. They're giving a lot more information on the internet voluntarily when they play games and they take surveys and they go on Facebook and they go on their TikTok than is ever asked of them in most of these situations.
I think you both raise an excellent point. And I think the onus in some ways does fall on the data community, right? Like there is historic mistrust because there has been misuse of personal information and data. And I think we have to come together and we have to demonstrate how data is being used for positive change, right? And how it is used for positive change in other places. And I don't know that we are our own best PR. I know earlier in the call, I think Kelly said data's not that interesting. It's super interesting. We just have to make it interesting, right? And make it accessible and show the utility of it, right? And like you said, Meredith, make it clear, like, hey, this is anonymous. We're not using this for evil. There is no permanent record, like in helping people understand that it's helpful. But I think, I think we live in a culture of mistrust and a state of mistrust, right? And so really taking active measures to build community trust and help folks understand how providing information is helpful when you provide it in the right way and not just on TikTok.
No, absolutely. I think that's a great point. There was somebody from the Education Trust out of California that did a presentation a while back, and they said that in the school districts, they do data walks for the parents, and they actually put up posters and engaging data and have parents come to walk around to show how the data is being used, how it's collected. And he stressed the importance too that they disaggregate the data. So that way you're not looking, I think we talked about it a little bit this morning, but the importance of being able to, show some of the disparities that, when you merge everybody together in one, then you miss some of the nuances that we may not all be doing well, and to make sure that we're looking at it by different groups. So by certain, gender groups, age groups, racial minority groups, sexual and gender minority, which sometimes we don't have, right? Some of that is the data gaps that, that we don't always collect some of the sexual minority information. Like with COVID, we're not able to say how those groups are impacted because we're not collecting it and not asking. And so it really gives a disservice, but maybe having more of those community walks. And I think the Gwynn Center actually did, and I'm trying to remember, but it was like beer charts and something. It had a really good, and I don't know why I can't remember it because it was very catchy.
Beers and bar charts.
Beers and bar charts. And I was,
Hey, Amanda, we just lost your audio for a second. No, it's just me. Okay, never mind. Sorry.
No, I can't hear her either.
No, I was going to say I can't hear her either.
I thought it was like checking my ear.
Can you hear me now?
Yeah.
Oi, I'm having issues. My second headset that went out this week. But anyway, so I was just saying, yeah, to do a better job of making it more interesting, being a little bit more creative, and making sure we're doing it in places where all the community members are seeing that data and the data is coming back to them. Because going back to the health district to make decisions, that's great. But how are the parents knowing how that data was used with the kids, and you know, making sure that they're understanding that and they're seeing it might help to instill some of that trust in the community. Perfect. So I want to open it up to see, does anybody else have any other comments or issues that they want to talk about on how we can make improvements for data in our state?
You know, I think it's really exciting to sit in a room and a panel like this, because everyone here is so open and we're all talking about exactly the kinds of things we talk about internally in our organizations and the challenges we experience. I will share a not as positive experience, because I think it's instructive, which is that a couple of years back, I want to say it was 2018, a group of people got together. I think we were all from nonprofits, and we were going to form a data group. And it never really got off the ground. And I wouldn't say it's because people were jealously guarding their data or anything like that. It wasn't negative. It was just that we only had 2 meetings, and it was like, it felt monumental. And I think that a lot of times it does, particularly because we might say that, let's say I've collected data on something about children in schools, and then, you know, Tara has something that conflicts with what she's seeing in kids count, right? And so then it comes into, well, then how do we harmonize? How do we make it public? And how do we do it on situations where we all are working with limited bandwidth? And so it's something that I think is I'm always so optimistic about. And that's why I do love these kinds of conversations, because I do think that if we can kind of figure out that way to move it forward, I think that there's so many opportunities to make the data accessible and usable, and to further what we're all trying to accomplish in our state.
Oh, those are great points. Sorry, I was just checking that to see if I was causing an echo. No, but those are wonderful points, and hopefully we will keep working to get to a place where we can make sure that our data are protecting the people that we're collecting it from, and also that we're sharing it amongst ourselves and then back out with the community. And so we all have access to use that data and to move it forward and make informed decisions in our daily personal lives, and at our organization level and at the state level. So I think that's wonderful. And I want to see if anybody else just has any last, well, I can ask, does anybody from our audience have any questions that they want to ask any of the panelists? Okay, we've had a shy group this week with some of those questions. Or you all just did such a great job of talking about data that nobody has, we don't have questions anymore. But no, that's great. And
May I ask a question?
Yes, absolutely.
Like, how can we use data to contextualize these experiences and further inform policy? Like, any thoughts about the connection there, particularly as we hope to go from the theory of legislation to the practice of change, right? Like, are there some ways in which you've seen it play out where the data was critical to the change that you want to see? Are there some ways that you think or hope stakeholders would be using it differently to move towards change? Like, what is that fundamental connection?
Well, certainly there is a fundamental connection in our opinion, at least at the Gwynn Center. And I think it's shared in this panel that it is hard, right, to get from the theory of policy to action. But if you use the data and you use it to inform the way, say, legislation is structured. So for example, again, if we know that a lot of people are uninsured in the state and there's a study that's being done on whether Medicaid buy-in is an option, well, you can look at that study and see if some sorts of plans or options ultimately will become available through a buy-in type of program. We don't know the answer to that, but it's certainly out there. And then you look at it and, you know, the federal government typically requires on a grant and evidence basis for programs. And the idea is a lot of times say it's maybe a demonstration. And what you would do is you would create some sort of maybe experiment or something, and you would see if something works in practice. And then if the data shows that that intervention was effective, that can be scaled up and become a larger program. And so there are different ways that it informs policy, and it does connect up. But the way we do it is that we use the data to understand the landscape and to see what's going on, and then we use that to further a set of recommendations and then socialize that with legislators to see if that's something that they're interested in. Now, of course, you know, different sides of the aisles will disagree, and our recommendations have occasionally been taken up and occasionally not, and liked by one side and disliked by the other, and that can vary in session. But the idea is that it does tell us where we are, and it tells us where we need to go. And that can always be embedded, I think, in a policy solution.
I'm a big fan of money data, any money data that you can come up with when it comes to the legislative session, because I think that the most conservative person that you've ever met and the most liberal person you've ever met see $300,000 as $300,000. I don't think that there's any sort of political leaning or inclination that makes someone look at a monetary number and say, that's just not that much money, or that's just a ton of money. That really comes down to someone's personal economic status. And I think that anyone who's involved in the legislature cares about, or should care about, individuals who see that as a lot of money and individuals who see that as very little money. So I personally think any data that reflects cost savings or cost expenditures is something you can really lean on when it comes to trying to inform policy, because you take the emotion out of it, you take personal opinions out of it, and you break things down in a way that makes sense to everyone. After that, you can build with stories and personal anecdotes and things that tug at the heartstrings. But if we can all agree on numbers, that's a good starting point for everyone. And then you build out your discussion, or you build out your point of view from there.
And I love what Kelly said, and I want to piggyback on that, because unless we have the hard numbers and the data and the money to back this up, nothing happens. But what we have found success with is, you know, we talk a lot about nothing about us without us. Where are our children in this conversation? Are our children our advocates? And how can they be our advocates better? Because while the dollar amount is the most important thing, what oftentimes will change someone's mind is listening to a middle schooler or a high schooler talk about how this directly affects me. And so how do we better use the children who we are all working with and for better, so that they can be their own advocates? And how do we build up the next generation of advocates? Because we all would like to hand this off to someone when we are all ready for retirement. And hopefully we can build that system within Nevada.
Oh, absolutely. And I think too, when we're looking at, you know, working with limited resources, I'm so glad that our conversation push has been more talking about equity versus equality, because we don't all need the same thing, and trying to give everybody the same thing sometimes wastes resources. And so being able to really disaggregate the data and show, look, not all of these kids are in need in the same way, and to be able to take those resources and say, this is what this group needs, and having the data to show that. And as Jamie said too, having that community lived experience to say the data shows this and their stories reflect this, that this is where the resources need to go, can be so critical when you know that even though it would be great to support all families, that financially we can't do that right now. So we have to do that with the families that are in the most need, and have a way to figure that out.
I think what everyone's saying here is sort of, I'd like to try to tie it together, not because I'm great at synthesis, but because I think I'm seeing things that are just kind of reflected so much in my own work. So I'll start with what Kelly said. I mean, a lot of times when you're talking about a subject area, you know, one, it's not about cutting the data and manipulating it, because we don't believe in that, but the data will tell a different story in a different way to different people. And so one of the research projects that we did was on personal care aids in Nevada. And, you know, you can look at that report, you can think about it. This is a workforce question, and personal care aids do not get paid at rates that are very high, and there's kind of a cost of living problem, and there's a whole, I can talk about personal care aids all day, but there's really one other piece in there that would resonate with different members, right? Which is that if you talk about the population of Medicaid that might receive personal care, if you get personal care in the home, you are avoiding a nursing home cost, which is really, really high. And in the time of COVID, we also want to avoid nursing homes for various other reasons. So you can, for the perspective of public health, let's keep people in their homes. From the perspective of workforce, let's keep them healthy and robust so that they can afford to put people in their homes. From the perspective of people who want to save money, this avoids nursing home costs. Now, to Jamie's point, let's tell the stories around it and have the people who were involved, whether they're the workers, the families, the children, because there are children with disabilities who are on these waivers who are getting personal care support. Let's have those stories come out and flesh out the narrative, and that way that can bring attention in a different way to a different group of people. So there are just so many dimensions of how to use the data. So I'll come back to Tara here, which is that data is very exciting. It's how you tell that story, I think, is so important.
And it's so nice to see too. We saw the next generation, you know, of advocates from Tara's daughter, maybe, who was just on the screen, to Kelly's daughter that participated earlier. And I think Tamika is still on the phone, and she gets all of her kids involved in advocacy, and they usually have a strong presence at Children's Week. And they, you know, the stories that they tell about being able to share their story and have people listen to it and respond, and to see that that can make change is so powerful, and can, you know, really elevate their experiences and give them passion if they wouldn't have had, you know, some of those experiences. So it's great to see some of that participation here during Children's Week. So any last final comments from any of our panelists about data?
I just want to thank everyone for coming out today and for organizing this, because I think it is important that we start talking about how important data is, right? And this is the beginning of hopefully many, many conversations around this topic area, and really start helping the community understand like how much more is available if we can just demonstrate need or demonstrate what's working, and really kind of optimize the use of data in our communities.
Oh, absolutely. And thank you to all the panelists today, and, you know, and I guess staying in theme with our women-led legislature. We've got our women-led data panel, which is fantastic to have everybody, you know, talking about data and taking the lead in that in the community. I think it's wonderful. And I know that I look forward to hopefully continuing this work with all of you. I think it is great to have a push again for how do we look at data and children's data, and I'll make sure everybody's invited, but we do have an early childhood symposium that is intended to try to bring people together to talk about data. How do we use data? Who has the data? Who needs the data? And what data do we, you know, what data questions do we still have in our community? And I think by keeping those conversations going, and all the excitement that we can keep, you know, making bigger and bigger impacts each year. So thanks to each one of you for taking your time and commitment to being here this morning and all throughout the session. And thanks to everybody else who's on the call today for joining us this morning for this important topic. So just for some of our next steps.
Patients.